My name is Amanda Brosnan, and I'm here today to talk to you about one word, a loaded word, a word that can come with unease, anxiety, stress, discouragement, even despair at times. A word that I've come to know well this past year, and while it's still difficult, I've actually come to find encouragement from it, excitement, even hope. And it's my goal by the end of this talk that you will see this word as I do, something that is exciting and encouraging. And that word is change. So you see, I remember and can't forget back when I'm walking in my classroom and I look at Kamisha's desk. She's one of 150 8th grade science students of mine in rural Arkansas. I notice, once again, she doesn't have her homework with her. So feeling frustrated and as firm a voice as I can muster, I say to her, Kamisha, where is your homework? And I can't forget the moment she looked up at me from her desk, tears in her eyes, as she said, they turned my lights off again, and I had to watch my brother and sister anyway. I couldn't do the homework. This was a pivotal moment for me, a moment where I was reminded Kamisha, like so many of my students, 99% in fact, were on free and reduced lunch, face daily struggles of poverty, racism, segregation, discrimination, socioeconomic and health disparities, all because of her skin color and the zip code she happened to be born into. Change. Change was needed. There I was looking around my 4 classroom walls, knowing I'm working to achieve or to close the achievement gap. But yet I struggled. What was I really doing here? I'm teaching, but Kamisha's going back to the very same environment that's keeping her down, never allowing her to catch up or even get ahead. So I was motivated to apply for PA school. Fast forward 3 years later, and I'm practicing in the heart of downtown San Antonio. Again, I'm in the room, the exam room this time. I'm sitting across the table from John, one of my many patients. And again, frustration is welling in me, and I say to John, why did you not do what we talked about? Why are you still eating junk food? We made a plan just 2 weeks ago. You see, John suffered from diabetes, and I had seen him 2 weeks prior with a blood sugar in the 500s. We had come up with a plan to eat healthier. And when I say we had come up with the plan, I mean I came up with the plan and told him what to do. At the time, I thought that's how it worked. And again, I can't forget this moment as John looked at me, tears in his eyes, as he said, I can only eat what my son brings me, and all he brings me is fast food. Digging deeper, I actually find out John has no transportation, and he suffers also from morbid obesity, so doesn't have a strong desire or will to really leave the house. Even if he could walk to the nearest food source, it was several blocks away, and it was a convenience store, mostly supplying liquor or junk food. Change. Change was needed. There I was, again, just like my 4 classroom walls, looking around my 4 exam room walls, wondering, what am I doing here? John is still going back to the same environment, like Kamisha, that's keeping him down, never allowing him to catch up or get ahead. The injustice, inequities, unfairness were overwhelming, and I knew more needed to be done. So I found the fellowship, a fellowship focused on health equity and leadership, 2 areas I felt I really needed to grow in. And I remember the day that I got the acceptance email. I was into the fellowship and immediately hit with so much excitement. But as excited as I felt, soon it was replaced with fear, a paralyzing fear. Change was here, but was I ready? Change was calling, but could I answer? I talked change, but was I ready to do the work? And as the directors can attest, I waited till the very last day, hours to spare before accepting the fellowship. But I had come to realize I was ready to do the work for change. And I remember walking into this very building on a cold January morning, less than a year ago, almost a year ago, and meeting each of you, people just as hungry and eager for change. That first week, we heard from various speakers on health equity, ranging from topics of unconscious bias to desegregating housing as ways to move the needle forward to advance health equity. Change was here. That second week, as we heard on topics of leadership and organizing as leadership, that's when change really hit home for me as I reflected on my clinic in San Antonio. You see, I knew we were serving some of the city's sickest and poorest, yet we had some of the worst health outcomes of our patients in the whole system, as well as the most unsatisfied patients and dissatisfied staff and providers. And I couldn't help but compare us to our more affluent sister clinic that was just several zip codes away that happened to have more satisfied patients, healthier and safer patient outcomes, as well as more satisfied staff. And as I did research, I realized there is a direct link between provider and staff satisfaction and patient satisfaction and patient outcomes. So I went to work, and that was my first project, changing the culture of my clinic, bringing joy to the workplace so we can better serve our patients and provide healthier, safer care. So using the Organizing as Leadership framework, I rallied a team around me, and we went to work to change the culture. But this is where I met a different side of change, resistance. You see, change is hard, and it's really hard when it's asked of you to look inside you and see, could you change because maybe what you're doing is contributing to the problem? And that's what we were asking leadership to do as we did survey after survey that all pointed back to things leadership could do to improve and change the culture. And this was a moment as well that I knew change was happening in me. Because in the past, when I would meet resistance, I would back down, give up, shy away, feel hopeless, quit. But this time was different, as I had each of you checking in monthly, brainstorming together, working through the Organizing as Leadership framework, and it gave me the confidence to persevere, and my team and I persevere we did. In just 4 months, we were able to improve provider, staff, and patient satisfaction scores, as well as develop 3 new ways of communication in the clinic, something that staff had said was lacking, and we did it with leadership buy-in. But change wasn't done with me yet, as my husband decided a change was in store for him. He wanted to move from the insurance industry to the aviation industry and go to flight school. So that involved a change to Dallas, Texas, which was a move for us, a change in community, and a change in jobs. And it was hard. But I had a cheerleading squad around me through emails, text messages, phone calls from each of you, supporting me and helping me believe in myself and to see the change as an opportunity. So I embraced it. And here I am, 5 months later, practicing as a PA for Tarrant County Public Health, and I am a change machine. Taking in pennies, spitting out dollars. But for real, I love change. It's still hard, but I'm hunting for it around every corner. How can we change a culture? How can we improve access to care? How can we change systems to make bring more equity to our care? I must have this change machine written on my forehead because, in fact, within the first 2 months, I was tasked with going to one of our outlying clinics for the health department and improving the culture as well as increasing access to care. And again, using the Organizing as Leadership framework, was able to rally a team together, and in just 2 months, we were able to increase our patient volume by about 200%, increasing access to care and changing the culture in the process. I'm now on a journey being placed at our clinic in downtown Fort Worth, and again working to change the culture, improve our workflow, increase access to care, and have been tasked to increase our access to PrEP services for the community, as well as networking between us and community-based organizations to better see how the health department can serve them. And I've learned in this journey over the year that truly to see change, we must be the change. Yes, stolen in part from Gandhi, but change. It's the force that can take a country wrecked by genocide, violence, hatred, and bring about unity, love, restoration, and forgiveness. Change is the force that can take a city and unite its health systems and even provide housing for its homeless population in Camden, New Jersey. Change is what takes a lawyer and inspires medical legal partnerships to help improve care for the older population of San Francisco. Change is what creates pipeline programs and allows high schoolers to dream and even pursue those dreams of going into health professions. Change is what takes a slum community in New Delhi and unites its people to try and vaccinate their children. Change. I've been so honored and inspired to work with each of you, change agents in your own communities. I thank you for letting me learn from each of you and witness the changes, including life changes, moving across the country, life changes of marriage, life changes of new life. I urge you to continue to be change agents, embrace change, be encouraged by it, even in the midst of resistance. I can't wait to see what changes you each continue to make to pursue and ultimately the difference you keep making in health equity across the world. Thank you.